Laprade Show continues on City News.
101.1 FM and 1310 AM.
Well, this is a very important month, of course. It is Movember, and we're thinking about men's health. So we wanted to speak with Drew Klein. Hi, Drew.
Hi, Sam. How are you?
I'm great. Drew is the president of FocusWave Clinic, and certainly this has been a very busy month of Movember already. Has it been for you as well?
Totally. At FocusWave Clinic, we are treating men's sexual health conditions like erectile dysfunction, Peyronie's disease, chronic pelvic pain syndrome. We use an amazing medical technology called focused Shockwave therapy, and we're offering a special discount for new patients this month, and we'll be donating a portion of all profits for the month to the Movember Canada charity. So it's been a great start.
That sounds great, Drew. And I think, it's a really important opportunity for us to talk about, honestly, topics that maybe people don't want to talk about. And it's important to do that. Men's health. There's always just been something about men sort of putting their health on the back burner. They don't like to tend to deal with their health issues. Is that what you find?
Generally speaking, we men, we suck at taking care of our health. We really do. Suicide, depression, addiction, coronary heart disease, various forms of cancer. We just dominate in all of these highly avoidable causes of mortality. And so men just generally have a more difficult time discussing or seeking help and making the necessary improvements as it relates to our health. And so the biggest issue is that men just don't want to talk about it. We just don't. But the stats are clear. The average men's life expectancy in Canada is 4 years less for men than women. 2/3 of Canadian men are obese. In terms of sexual diseases, what we treat here at FocusWave, nearly 50% of men over the age of 50 suffer from erectile dysfunction. 10% suffer from Peyronie's disease, about 4% from chronic pelvic pain syndrome. And so this is why, the Movember Men's Health Campaign is so important, to push men to advocate hard on behalf of their own health and to make better lifestyle choices, reduce stress, and just take care of yourself.
Mm-hmm. Drew, let me ask you this, and obviously I'm not a man, so I don't know. All of the physical, challenges that you just talked about, I'm assuming that there's a lot of pressure then on mental health.
Absolutely. Mental health is a huge component of men's health. Depression and suicide, like I mentioned, are much, much higher for men, and especially during this, pandemic period that we've been in, it's taken its toll. And so, absolutely, we are very well aware that mental health needs to be corralled, and men need to get better at talking about it and dealing with it.
Let me ask you, Drew, someone comes in to see you for the very first time.
Yeah.
Are they nervous?
I think, I handle all of our incoming triage calls and surprisingly, most men are quite open and quite verbose, and they feel comfortable at least talking to me about it. When they come in, for sure, I think there is some reticence, but for the most part, the men who come in here have decided that they're going to take control of their life, and they're going to start to look to improve their sexual wellness and performance, and it's a very important part of men's health is that.
Absolutely. So when somebody, maybe you spoke to somebody on that triage time when they're just coming in to see you, do you have an opportunity to chat with them after treatment?
Oh yes, my office door is always open, and we have a vascular surgeon, an IMG, who does all of our treatments and assessments. He's great. He talks about diet, nutrition, exercise, and a number of other things that are important. So keeping the door open via email, via text, by phone is important for me, for our patients, because when you come in here, you're not just getting a treatment. We want to really help you to recharge your vascular health, and using this amazing regenerative medicine that we use, it's a great combination. And
do you ever hear stories about men and the partners that they know that this has been a good step for their relationship to keep their relationship healthy?
I was going to say that women exert an extremely important influence on the decisions that men make to seek, health care. So we tend to get most of our support from our female partners and very little from our male friends. So actually, according to some studies, 3 times more likely than women to be influenced to seek health care. And married patients are like almost the same, 3 times as much more likely than unmarried patients to get health care, to be influenced to seek health care. So women are really a key ally in this process to getting men healthy. We rely on you guys to speak up, to push us, to help us, particularly when it comes to making health decisions.
It's so interesting because I think, there's a lot of topics that ironically, I'll tell you right now, I've been divorced twice, so I've been around the block a couple of times. I think there's a lot of topics that sometimes just, the dynamics of a couple can be more challenging to talk about than others. And I think you brought up a really good point today that as women, it's important that we have these conversations too.
Absolutely. And there's an old joke, why is divorce so expensive? Because it's worth it. And if it makes a difference to your health and your well-being, absolutely, it's something you should do. If you can work on your relationship, that's extremely important. Men and women tend to keep their issues to themselves and maybe not discuss it enough. And divorce is not a pleasant thing. And hopefully there can always be some positives that can come out of such events.
Absolutely. Now, I think when we think about Movember, we think guys growing mustaches and raising a bit of money. But the reality is this organization, Movember, has raised a lot of money, especially in this country. And each and every one of those dollars really go towards the things that you talked about, mental health, and of course, other issues that Movember supports, prostate cancer and lots of other different issues that men are facing. Are you growing a mustache, Drew? I have to ask.
Yeah. So I am, and just some men grow mustaches to draw attention to these men's health issues in the month of November, and I think the Movember mustache is more than just a cute little virtue signal. It's actually a supremely effective way to raise awareness for these issues. When you don't normally have a mustache, which I don't, and you show up with a mustache, people notice you have a mustache. In fact, my wife won't even come near me with this thing, but I'm willing to make that sacrifice. I'm growing the mo and I'm helping a bro. Well,
that is awesome. I love it. And I think your wife is not alone, by the way. Right?
Yeah, it is. It's true.
Absolutely. Well, hopefully it'll be a better December for you, my friend. Thank you so much, Drew Klein, for everything you're doing for Movember and everything you're doing for men's health. It is appreciated.
Thanks, Sam. Appreciate the time.
Drew Klein, president of FocusWave Clinic, a really important conversation about men's health.